My name is Jayne Needham and I'm the Director of Strategy, Partnership and Population Health at Derbyshire Community Health Services. A quality conversation to me is probably one of the most powerful tools that I've ever been given in my work toolbox, and it is something that really makes me recognise that I now have the ability to listen and to reframe back to the people I'm talking with to make sure I have truly understood what they're trying to tell me. So quality conversations is something that I became aware of around and about 6 years ago, and it matters massively to me because I've seen the difference that having a quality conversation has both on the person who's becomes trained in those skills and the person who they are working with. Being able to feel listened to and knowing that the person talking with you is really paying attention to what matters to you and is able to act on it is hugely important. One of the things that stays in my brain is someone once said to me that conversation is the most underrated skill of the 21st century, and being involved in quality conversations has really made me think long and hard about that. Making sure that you listen, understand and take on board the other person's views can change completely the relationship that we have with each other. There are lots of inequalities that are happening here and now, and one that feels really important to talk about is the difference in life expectancy and healthy life expectancy between our most affluent and our poorest areas. If you're a female living in our most affluent area of Derbyshire and you're 47, you can expect to have 24 more years of healthy life. If you're a female in our most deprived area and you're 47, you can expect to have just over 3 years left of healthy life. And healthy life means the time we remain alive but have conditions that impact on our well-being and our health. And that really matters. It's great to live long, but we want to live healthily as well. That's a huge inequality and it's happening right now. When I think about what is affecting the population health at the moment, particularly after the pandemic, then it's issues that are really sensitive to discuss with our clients and with our communities. It is things like poverty, like social isolation, like employment and housing issues. It's also things like obesity, lack of physical activity, smoking behaviours and substance misuse. And for our staff to feel confident and competent to be able to get into those really sensitive discussions with the people who they're coming into contact with, we need to make sure that we're supporting them with the right skills, because the power of being able to have those sensitive conversations about things that are impacting on our population health now, if we can do that right the way across Derbyshire, across all of our partner organisations, the impact on improving health will be massive. Well, the thing that really stays in my mind when I've spoken to staff who've undertaken the training is not only about what they tell me about the impact it's had on their work environment, but really interesting, the impact that they tell me that it's had on their home life and their life outside of work, how it's improved and given them confidence to have different conversations with their children at home, with their elderly parents, with their partners at home, and also in their work environment, not actually dealing with clients, but in having conversations with their peers, with their teammates, with the people who might report into them, or to their line manager themselves. What staff I remember most telling me is, this has really helped me in the broadest sense. It has given me much more than confidence about how to have a conversation with the patient or the client in front of me.